large structures. So this is going to go up and service the upper body. This is going to go down. This is the descending aorta. They also can have some other terms for it. But anyway, this is the blood that's going to take, or the large vessel that's going to take blood down to the rest of the thoracic cavity, to the diaphragm and the ribs and so forth. Okay? All right, so this blue side over here, you have this large vessel, and you've got one here. This is the caudal vena cava coming up from the posterior part of the body, or caudal. And then you've got this anterior or cranial vena cava. So this is dumping blood back into the right atria. The right atria will pump it into the right ventricle, and then it goes back out that pulmonary trunk, which we talked about. So you guys are welcome to kind of look at this, make sure you understand the flow. You should know which is oxygenated, which is not oxygenated. If you were to cut the heart on your fetal pig, what you would find is, if you looked at it, the atria, which you can tell just looking at, are fairly thin walled. The right ventricle has a much thicker wall, but when you compare it to the left ventricle has a much, much thicker muscle mass. And if you think about it, okay, the right ventricle is pumping blood to the lungs. Now, unless you have pulmonary disease, if you have pulmonary disease, sometimes you can start getting an enlarged part of your heart over here because it's hard to pump to the lungs. But for the most part, the large pump in the heart is the left ventricle because it has to pump it out to the rest of your body. Okay? So I'll leave this up here and you guys can play with this. I'm happy to come around, quiz you on things, or point out structures.